Well, thank you for staying with us. And that was of course, Kakaaki Socials with all of that energy coming on from her constituency. But lots of conversations to have there, really. A lot. And I think that, what's really is very important is that Nigerians still do find time to do memes and skits.
They have all the time. They have all the time. That's where they go for free. Even mainstream may want to sometimes charge them because, that's a secret. Because of interest and all of that, but they have all the free time, all the free space to use on the space of social media to air their views and perspectives.
Indeed. All right, so we now move over to our second conversation, but we will not be handling that. Of course, Dr. Denise Ejoh is right there, going to take it over from here on our cancer awareness program that comes up about this time this week. Over to you, Doctor.
Good morning. How are you guys doing? We can't see you though.
I can see you and hear you clearly.
Thank you. Good morning. How are you guys? Thank you. Good morning, viewers. It's another week. It's another day. Thank you all for joining us. Together we fight. Together we win. That's my slogan. I think I believe it. No, I don't think I believe it. I do. Good morning, everyone, and welcome to another edition of Comorde Cancer Awareness with Dr. Denise Ejoh in partnership with AIT. I am Denise Ejoh. When most people hear the word cancer, they immediately think of breast cancer, prostate cancer, or cervical cancer. Those are important conversations. But today, we're talking about a cancer that many Nigerians have never heard of. It is sarcoma. Because it's uncommon, many people mistake it for an ordinary swelling, a sports injury, arthritis, or even a spiritual attack, our words. Some spend months or even years moving from one place to another before receiving the correct diagnosis. Yet, like many cancers, early diagnosis can make a significant difference. So today, we'll try and answer some very important questions. Joining me this morning is someone passionate about improving cancer care, my personal person. Please welcome Dr. Biyi Olutunde-Olusegun, a consultant clinical oncologist at the University of Port Harcourt Teaching Hospital. Dr. Biyi, good morning. How are you doing?
Hello, Dennis. Good morning. Good morning, viewers. And how are you doing, Dennis? Hanging in there, I hope. I'm really sorry. I'm so sorry about the recent passing of your dad. And I know I'm getting, I just have to mention this. I can't even imagine that you are on air at this time, knowing that this just happened a couple of days back. And with all that you're going through, we're praying for strength for you. Thank you for always holding up the front and speaking the truth about cancer everywhere you go. And thank you for that smile. Unbelievably good.
Thank you. Thank you, Doc. How are you? It's very nice to see you.
Pretty good. It's good to see you too yourself.
Thank you. So let's go. Let's start this conversation. And let's start with basics, because even I never get to understand sarcomas. I lost a very close friend of mine to sarcoma. One of her deaths was sarcomas, and I didn't get it. I saw it, but I didn't get it. So many viewers today are going to be hearing the word sarcomas for the first time. So what is sarcoma?
So sarcomas, you're right, they are not the commonest cancers out there, and people will usually not know them unless we speak about it, or unless they know someone who has been diagnosed. But so the way the body is structured is that we have a lot of supporting tissues that uphold the body, either they connect or they are holding up the body, and these things are generally called supportive structures of the body. And unfortunately, there is nowhere in the human body except the nails and the hair that I am aware of that cannot develop cancer. So sarcomas generally mean it refers to when cancer develops in connective tissues of the body that either support or connect, or surround, hold in place things. So this connective tissue is the area where this type of cancer, this abnormal growth starts from, right? And broadly, we have two classes, which will be osteosarcoma, referring to the rigid structure that is the bone. But I think today we're more interested in talking about the soft tissue sarcoma, which refers to all other forms of connective tissue. So like the fat in the body, like muscle, coverings of certain organs, structures within vital organs like the uterus and all of that. Now, so the connective tissue in itself are things that we don't think about every day, but that they serve a lot of purpose in keeping us healthy, keeping us who we are, keeping everything in shape. Now, blood vessels move blood from point A to point B, but then they are not, we don't typically think of them like we think about the liver or the lungs and things like that. And it's this connective tissue, supporting structures that surround and all of that, that give rise to what is called sarcomas. It's when cancers arise from this connective tissue that we regard to as soft tissue sarcomas.
So I'm going to try and be a layman here because, you people use the language. So soft tissues. I'm going to give an example. Are you referring to soft tissues as like the thigh, the arm? Is that what you're? Is that
great question? Yeah. So
soft tissue?
Soft tissue is everywhere in the body. Honestly, it's in the brain, it's in the thigh, it surrounds the organs themselves. It acts as a supportive structure. Sometimes it's in the blood vessels. So you can have a sarcoma, which is a soft tissue cancer arising from any one of these structures. So you can have it in the head and neck. You can have it sometimes in the chest. You can have it in the limbs, the upper limbs. So if, for instance, it's happening in the limbs, then it would be like maybe a muscle in this place, or maybe the fat from around there, and then cancer develops. But these things can happen anywhere all over the body. So you would have head and neck, you would have the trunk, which is the whole body, and then you could have cancer in the limbs. And all of this, as long as they're coming from supportive structure that is not bone, then they will be collectively termed supportive soft tissue sarcomas, generally speaking. Does that help?
Yes, I think so, but maybe we'll keep going on this thing to make sure.
Just keep going.
Yeah. So one reason people don't know about sarcomas is relatively because I think it's rare. I don't see a lot of conversations about it. I do hear, I see the adverts on it, but I don't really see. So, how different is it from the cancers we hear about every day? Is it the same? I would say to you, I think I know a lot about cancer in a lot of ways, but I don't really think I understand sarcoma. So now you've explained the first part of it, which is where I can find it and how it should appear. So what makes it different? Because sarcoma in the sarcoma and the one in the body.
There may be breast cancer or prostate cancer. Yeah, okay. So cancer is always cancer, right? Wherever it is, there's something fundamentally wrong with a cell in the body, whether it's a breast cell or prostate cell or a soft tissue cell like we're talking about now, that ideally should live for a specified duration and then naturally die off, so that there is no overpopulation. So what happens in every form of cancer is that normal cells that should divide for a period of time and then die just don't die. They adopt immortality and then just keep dividing and dividing. The trigger for this is usually multifaceted. So, but whatever the cancer is, whether it's starting in the breast or it's starting in the lungs or it's starting in the soft tissue, this would be what is going on. A muscle cell or a fat cell or a connective tissue cell, nerve covering cell just starts to divide abnormally and keep going forward. But because we don't have enough information about it out there, one of the challenges is that a lot of people attribute sarcomas, particularly in the limbs, to other forms of injury. They are not even suspicious ab initio, at the time when they can get the best level of care that can that can't bring about cure, they usually think it's nothing, right? Because say you notice, I'll just jump into how they could present, like with a small painless swelling.
I
So
was
the
just
key
about
word
to
here
say
then
that.
is
Yeah.
painless. This is what the biggest challenge with most types of cancer is that there is no pain at the time that the problem starts. There's usually no pain. So there will be mild exceptions based on the connection. But let's look at things that we can see. Someone develops a small swelling on this part of their hand. It's not paining them, it's not restricting movement. They probably just think of it as, a bump. I don't know when I hit this hand, or did I fall? And interestingly, there might have even been some trauma, like a week before that happened. Well, it's just coincidence, right? But because there was a child who escaped from home, went to play soccer, had a fall, the mother caught him, and then suddenly there's this bump on that leg. You see where that coincidence is, and they say, "Oh, he fell." Then they start to massage, put rub, and do all of those things. I think this sort of separates sarcomas from the general other types of common cancers, because we do know these cancers, we know what their symptoms are. We always talk about them much more often than this sarcoma that we're talking about, and it's a great thing that that's what you picked up today. So generally speaking, this is probably what would differentiate them: the painlessness at the beginning, and then going on to become, someone's thigh. If a sarcoma starts in the thigh can almost double in size, and there will still be no pain. Right? So these are certain things that make it quite peculiar, Dennis.
Thank you.
You can go ahead, Dennis.
Okay, so I think we should continue. You're right. I think the station are not following. Let's go on to the next question. Also, sarcomas are different. So I'm going to ask you the next question, and that because there was something you said which was very interesting, and that was the fact that sarcoma do not necessarily have hurt, never hurt, and it's very interesting. Okay, so let's look at this. Why awareness matters in Nigeria, and that is the key thing, because we are very good at having things wrong with us and we don't act. So why is awareness of sarcomas especially important in Nigeria?
Okay, so a brilliant question. There was a bit of background noise, but I think what I heard you say was, why is the awareness important? Why is a program like this that you are doing really important? Look, the thing with sarcomas is that they are pretty tough and difficult to diagnose. First of all, detect that there's a problem. They are also mostly amenable to surgical treatment, right? Mm-hmm. And for you to be able to do a surgical treatment, the disease has to come in early. So again, let me use my hand because it's pretty visible. If a sarcoma starts in this hand, and a person catches it early, a simple surgery to sort of just cut off somewhere like this. I should turn around. Okay. Yeah. A simple surgery to just cut off an area like this may be all that person needs to survive. But the problem with it, because it was painless and it has gone further before the patient comes in. A reason where a cancer that started here has then spread all over here, and it makes it pretty challenging for you to then fix. And at that time, the only solution may be to come here and then take it off from here, right? Because the patient didn't present early, and that's a loss of a limb. So imagine if this is happening on the leg. Imagine if it's happening on the head and neck. Imagine if it's happening somewhere inside on your chest, right? And that window of opportunity to carry out that surgery really early is missed, then you can't. There's much more damage. So if we're not talking about it, if people are experiencing symptoms like so depending on where it started from, a painless swelling in the knee or in the thigh or in your arm, or you notice a bump on your head, or if it's on the inside of the brain, maybe there's persistent headache, or maybe on the neck you notice a swelling. If someone doesn't make a move very quickly, right, it's going to be so devastating at the time when you finally get to the hospital. And it even gets worse because the patient comes to the hospital and doctors are saying, oh, I'm really sorry, this small bump that you thought was a pimple has then gone on to involve this hand, and there's no way we can excise this. We think it's in your best interest to take out this hand. And then the man is devastated, and it's a difficult decision to make. They can't come to terms with that, like, this thing is not even hurting me, or it only just started hurting me, or it only just started bleeding. And why are you telling me you're going to take off my whole hand? And so they leave the hospital and go to other places looking for other forms of care that will do anything but take off their limb. And then, of course, unfortunately, too many charlatans, unregulated charlatans out there who deceive people, talk about all sorts of stuff. We should talk about again and again, maybe on another one of your programs, about this so-called effect of alternative medical practices. I'm not saying they are not good for what they are good for. I'm just saying that they are not good for everything, And then by the time that patient pursues that, trying to save, say, maybe that hand, he eventually comes back and we now have cancer that has spread to the lungs, that has spread to the liver, and was even in a worse state. So even taking off that hand or taking off that leg is not going to be of any help anymore, because the cancer is now in the lungs, is now in the liver. So the more we talk about it, the more people are going to take steps, hopefully, whenever they see something. I'm not saying every bump you see on your body or every discomfort you have is cancer, but I'm saying that every bump may be cancer until you've checked it out before you will really know what it is. So advocacy can never really stop with anything cancer. Dennis.
Okay. Thank you. So you're going to do one last thing for me, and that's your message to healthcare workers. Just a message, and the better public. Just give me, I'm rounding off now. So what message would you like healthcare workers, members of the public, to remember about sarcomas? So what is the key thing they have to remember? I mean, I've already picked up a lot of things, but that's me. What is your own thought?
Great stuff. So as much as sarcomas is not common, if you're watching this program, we're not trying to peddle in fear or alarm. We're trying to increase awareness. So please, if your child or someone you know has a complaint of a swelling, whether it is painful or not, but it's not reducing, maybe characteristically even slowly increasing in size, despite the fact that there might be a preceding history of trauma or not, if they have any other symptoms, blockage of their nose that just won't go away, pain or swelling anywhere else in some of the tight places like the neck, abdominal discomfort that is persisting, how about you go to a hospital, a proper good hospital, get yourself checked. If it's something minor, checking will detect it and it will be solved. No assumptions here. If it's something major, checking will detect it, and then steps can be quickly taken to prevent it. And I think that for healthcare workers, please have a high index of suspicion. Stop being nice to patients and trying to make them think, oh, it can't be serious. Why don't we just assume the worst and then find out we are wrong, rather than encourage patients to think it's not serious and then it turns out to be sinister. So, and if anything is beyond your expertise, please refer the patient. Sorry, Dennis, you can go ahead.
No, thank you. I like the way you've ended it. Assume the worst and then get the best outcome. Yeah, that is fantastic. That's a nice way I want to end this, actually. Assume. Thank you so much, Dr. Biyi, for helping us understand a cancer that too many of us don't understand, and it goes unnoticed. Today's conversation reminds us that rare does not mean impossible. Although sarcoma is less common and many other cancers, it can affect children, young people, and adults. Knowing the signs and seeking medical attention early make a real difference. So to everyone watching, if you notice a lump that continues to grow, swelling that does not go away, persistent brain pain, or any unusual change that concerns you, please don't ignore it. And don't rely solely on home remedies or assumptions. Get it checked, as our doctor just said, by a qualified health practitioner. So at Comorde Cancer Foundation, we believe that awareness saves lives, and every conversation brings us one step closer to early diagnosis and better outcomes. Thank you for joining me. And next time we will have Professor Odedino, the chairperson of the NCCP Technical Working Group of the Federal Ministry of Health and Social Welfare, to talk about some serious changes that have happened in the cancer space and in the medical space. So until then, stay informed, stay healthy, and remember, early detection saves lives. Dr. B, thank you for joining me, and thank you, our viewers. Fantastically. Together we fight, together we win.
Thank you, Doctor. Of course, that was a great conversation. So assume the worst and then let it be that we are wrong.
And you get the best out of it.
Indeed. All right, it's now time for
Entertainment and lifestyle.